Thank you so much. And, having done so many virtual presentations over the last few years, and now as we're entering into this hybrid space, I just have to tell you, I am really jealous that I am not in the room physically with all of you, but I am excited to be here today, and I really appreciate the invitation from your group and love the name. And so we are all together trying to tackle air pollution at schools. And it's exciting to be working with those of you there who are engaged in the same kind of work that we are here. And so as you heard in my introduction, I'm Tracy Washington Enger, and I'm with the U.S. Environmental Protection Agency. And I'm sure many of you know our job at the U.S. Environmental Protection Agency primarily is as the regulation, writing, and enforcement arm of environmental issues in the United States. That being said, probably one of the first things you need to understand about this program and the work that I'm going to be describing is that there is no federal regulation for indoor air quality in schools in the United States. So the work that I do is in a voluntary program where we don't have a stick. We cannot beat people into compliance submission with indoor air quality in schools. So we have to have a really beautiful, attractive, honey-coated carrot to get people to voluntarily take action. And yes, and as we will talk about a little bit here too, over the last 3 years, COVID has helped us sort of force feed that carrot onto people for indoor air quality in schools, because this issue became a lot more attractive when indoor air quality was the thing that stood between schools being open or schools being closed. So so in a way, the pandemic was a bit of a boon for the program, an unwelcome one, not one that we would have chosen, but we are certainly not going to let a perfectly good pandemic go to waste. What an amazing and smart group of people you are. The questions that you surfaced and were curated by the leadership there at TAPAS to present to me, everything that you came up with are exactly the questions that we're engaged with in the United States and across the globe when it comes to dealing with indoor air quality in schools. Everyone wants to know, what should people be doing? Why aren't they doing it? How do we get them to do it? When they do it, what should they be doing? And when they do what they should be doing, how do we know that it's working, right? And that's basically the questions that we're all engaged in with this program. And so over the course of this presentation, I'm expecting to hit on all of these. But if I don't, to your satisfaction, at the end, we will have some Q&A as well. So a little bit more by way of introduction for myself, how I came into this work. So I'll take the next slide. So I've been with the U.S. Environmental Protection Agency for nearly 30 years. But before that, I was a Peace Corps volunteer in Sierra Leone, West Africa. So many of you know Peace Corps is the equivalent of your VSO. Except VSO volunteers actually have to have a lot more experience than Peace Corps volunteers. So I was recruited as a teacher in Sierra Leone, West Africa. And that's where I fell in love with schools and with watching the miracle of learning, and with public service. And in Sierra Leone, when you look at this picture, it is so astounding because they're, unlike the United States where we have, free public education, there was no free public education in Sierra Leone. Every student who was there paid to be there. They bought their uniforms. They were totally bought in and invested. And what I discovered while I was there is that every student anywhere in the world, every parent everywhere in the world wants the exact same thing. They want to send their kids to a school where they're going to be safe and well educated and prepared to have a future just a little bit better than their parents' future. Everyone wants the exact same things for their kids. And that's why whenever I'm doing this work, I always start with the why. So I'll take the next slide. Why are we doing this? Why are we engaged in this work? And it is because healthy school environments, healthy indoor environments are really predicated on what we call a three-legged stool. Yes, it is about controlling things in the physical environment, but for what purpose? For what purpose are we trying to create the best, cleanest, most highest performing facilities that we can? It is because of the impact that those facilities, the direct impact those facilities have on occupant health and on student performance. And student performance and academic performance and staff performance, the ability to teach well and the ability to learn well is the bottom line for most schools. And so drawing that line, making that connection between what happens in the physical environment on occupational health, on occupant health, and on performance is really critical, is key for us as we're making this pitch to schools to make these changes, especially in the United States, like I said, where it's all voluntary. So we have to connect it back to this triple bottom line, right? I'll take the next slide. So looking at the physical environment, and this is the place where we are most often thinking about indoor air quality, as well we should, because we know things about our schools here in the United States. And one is, so I'm at this moment acutely aware that I'm talking to, a British audience when I say our schools are really old, right? Well, yeah, old for us. But the average school, in the United States is 55 years old, which is not necessarily a bad thing. With other old buildings, we put plaques on them and we call them historic and we restore them and we take care of them and we preserve them and we revere them. Often not so the case with schools. And so it's really important to recognize the age of our schools and what that means in the way that we need to take care of them. And we know also that, at least a quarter of our schools are in need of extensive repair, and half of our schools report complaints on indoor air quality. So the physical environment and the age of the schools being really critical for how we're maintaining them, how we're cleaning them, and what we're doing in that space. Because I'll take the next slide. We also know that we have in the United States an $85 billion spending gap between where schools currently are and where we need them to be, just to be adequate and equitable facilities, right? Not amazing and superior, not mind-blowing, adequate and equitable. $85 billion stands between us and that outcome. And it's really important because, of course, we know that studies, demonstrate that poor facilities are associated with all kinds of poor outcomes, truancy and high rates of suspension. People don't want to be in crappy buildings. They want to be in great buildings and great facilities. And our students and our staff deserve that. So I'll take the next slide. So one of the ways that we talk about this is we liken that school building, especially over this last 3 years, we started to talk about it more in this way. We liken those school buildings to the human respiratory system, right? We know for a fact that it is the pollutants and the viruses and the poor indoor air quality that we're trying to manage is addressed through stronger filtration and ventilation. And in the same way that we breathe into our bodies and we have functions in our bodies that help to filter out some of those bad pollutants when they get, and we know when they get in, the impact that they can have, same with the building. And so helping people understand, making that connection for folks with something that they can relate to and understand. And so the respiratory system and the HVAC system, trying to get, good air in, good air out. I'll take the next slide. Because again, what we know is, and this is what we know for a fact, is where students learn is just as important as what they learn. So there's a huge impact on student performance from the facilities that they're in. So we take the best teachers and we train them, and we take the best curriculum and the best technology, and all of these things should certainly be present, but then we put them into a horribly maintained building, and somehow we're shocked when we don't get the kinds of academic outcomes we're looking for. Well, that is, again, because we have evidence of how indoor air quality impacts learning and thinking. I'll take the next slide. So numerous studies have been done on this around the world, and one of the ones that we lean on most recently comes out of Harvard University, from Dr. Joe Allen. Some of you, I'm sure, have seen his work, and he is just committed to the impact of buildings on human health. And so they're at the Chin School of Public Health, they put out this report on schools for health and looked at a myriad of factors that impact student health, including indoor air quality, and also sort of how those different factors are connected, right? I'll take the next slide. And one of the things that they looked at was, high CO2 levels. And, people were asking about what do you monitor, for, to determine your indoor air quality. And CO2, of course, is one of those things we look at often because it is not a measure of whether or not you have good indoor air quality, because that is going to be a number of factors taken in tandem, but it is an indication of how well you're ventilating your spaces. And the impacts of high CO2, because it doesn't come without impacts, right? And so we know that when you have high CO2 levels, attention starts to drop, comprehension, decision-making, concentration, all of those things start to drop the higher the CO2 is in the classroom. And so both as an indicator of how well you're ventilating because of the impacts that it has on what you're trying to accomplish in the classroom. I'll take the next slide. So in addition to indoor air quality, or also sort of in combination with indoor air quality, are other physical factors, of course, lighting and acoustics. And, and when we think about indoor air quality, we also want to think about the fact that when we are taking mitigation actions, we want to make sure that the mitigation actions that we're taking are not negatively impacting some of the other factors that influence and impact learning in the classroom. So we've talked about, the placement of supplemental air filters into the classroom to help with air exchange, especially during COVID. But teachers complain that they are loud sometimes and that they are distracting. And that is important. It is something that we need to take into consideration when we're making choices, because the inability for a student to hear the teacher has an impact. So really looking at how we combine all of these factors. Okay, I'll take the next slide. Then, of course, the other issue, and the one that I think is one of the most motivational, is around occupant health. And again, it is incumbent upon us to be making that connection between occupant health and the physical environment so that people can recognize that what we're breathing and the environment that we are in indoors does have impacts. And so when it comes to indoor air quality, there are the things that we can see, the coughing, the sneezing, the sinus connection, irritation in the throat. You can see it in terms sometimes of headache and nausea. And a lot of these symptoms sometimes are associated with other diseases or other health impacts, but being able to recognize, oh, this could also be related to indoor air quality. But of course, also, in the United States, asthma is a huge problem for kids, and we're going to talk about that a little bit more. I'll take the next slide. So here's what we know. Again, when, with healthy school environments equals improved occupant health. So here's a couple of messages that I think are really important, especially as they relate to schools. So we know that overall, indoor air quality is critical because it can be, concentrations that you find of pollutants can be so much higher indoors than outdoors. And in schools, this becomes particularly critical because of the school setting itself, but also because of the occupant. So students, kids, are not just little scaled down adults, right? They are physiologically different, and their behaviors are different. And that makes a big difference in how they are consuming air and the impact that it's having. So they breathe deeper and faster. So those, particulate matter and other sources of air pollution are likely to go deeper into their lungs, right? They have behaviors. One of my friends calls her second grade class. She says that the kids are belly botanists, right? They're low to the ground. They're always on the ground. They're touching things. They touch the ground. They touch their mouths. They touch their noses and they touch their mouths. I raised two boys. Children are a little gross, right? And so we have to factor that in. It's important. So, and also the staff that are in those classrooms, really critical, because staff can be in those classrooms for many more years beyond, or in those schools, many more years beyond the students themselves. So the exposure they're going to have. When it comes to asthma and indoor air quality in schools, again, I really hit on this because this is one of the most important areas for schools because of the direct connection to absenteeism, to presenteeism, and to learning loss, right? So 10 million school days in the United States lost each year due to asthma. And that's just the students. And that doesn't take even into account the parent who has to be home with them and the other impacts. But in terms of just learning loss, because every school day really does count. And when a student isn't there in the classroom because of asthma or some other respiratory illness that is exacerbated by indoor air quality, they're not getting that learning back. So it is really critical that we make that connection as one of the really important things here. So when we're talking about this with schools, I'll take the next slide. One of the ways that I have come to think about this is we have this emerging model in America in our healthcare system. And I'll just, say flat out that, our healthcare system, every country's healthcare system has challenges, but ours has a lot of challenges. And one of the things that we're looking at to try to address that in the public health sphere is this idea of the patient-centered medical home, where instead of sending patients out to find this, all of these disparate services, it's the idea of putting the patient at the center of an array of services and delivering them there in a holistic way. Next slide. So when we think about schools in the United States, one of the things that's happening, and it is in part because of the fact that we have a broken public health system, is increasingly school is becoming the place where students receive their primary health care. Increasingly, we're having school-based health centers so your primary health care provider is there at school. And so when you think about that, what does that then mean for the kind of facility you have to be running in order to deliver a service like this? What does that mean for indoor air quality? What does that mean for the quality of your service? We talk about, when we were during COVID, how much intervention do we have to do for indoor air quality? Our schools aren't hospitals. Well, in some cases, our schools are darn near hospitals, right? So what does that mean for how we need to address indoor air quality? I'll take the next slide. So for me, what that means is recognizing that more and more our schools really are becoming what I call student-centered educational homes, because for millions of students in the United States, their school is the cleanest, healthiest, safest place they are going to spend time all day. They come there to be nurtured and nurtured in every conceivable way. So it is really important that we think about this as opposed to a set of disparate kind of services that the student has to figure out how to acquire, that we're putting that student at the center of an array of services and delivering those services to them. So how do we do that? Well, I'll take the next slide. In our program at the EPA and the Indoor Air Quality Tools for Schools program, it looks something like this. We provide guidance and training and resources to help school districts implement comprehensive indoor air quality and energy management programs. And we target it at the most important issues that schools are dealing with. And we do it through partnership with an array of people and organizations. And we really collaborate at a high level with our federal family to deliver in an action learning model all of this guidance in a way that helps school districts and schools be able to take action on it immediately. Next slide. Another way of looking at that is, for the last 25 years or so, we've been creating sustainable and healthy indoor air quality in school facilities programs, and they are predicated on these three pillars. So the first pillar is, our knowledge base. It is really spreading best practices, and that is through the development of specific guidance and trainings that we create in order to surface, identify, and spread best practices. And we do that through pillar two, which is this amazing network of stakeholders that is everyone from our federal family to our nonprofit and non-governmental organizations and agencies, universities, but also the school districts themselves who have offered their services in terms of mentorship and leadership to their peers, because that's who other school districts really want to hear from, is their peers. And we connect it all together through the third pillar, which is our Action Learning Network. And so that is our webinars and our in-person trainings and our connector network of, which is our listserv of over 100,000 contacts that we send information to. And we use that training and the webinars to connect the people to the knowledge. I'll take the next slide. So you see here, so our buffet of resources that we make available for free, starting with our Indoor Air Quality Tools for Schools Action Kit and our framework for effective management, our webinar series. We have also guidance around called Energy Savings Plus Health, a guide to interactive indoor air quality, and that is helping folks really dig in when they're doing energy retrofits and energy projects to make sure that indoor air quality and health are still considered. And then our Indoor Air Quality Tools for Schools preventive maintenance guidance, and that is sort of our action kit graduate school, right? It's 201, how you move forward from putting the guidance in place to proactive and predictive behavior. I'll take the next slide. So I'm going to take you just on a little cook's tour of what some of this looks like, right? So our action kit, we put together after, when I talked earlier about, at least half of the schools in the United States who report indoor air quality issues. We know that because our general accounting office back in 1994, and then again, 20 years later, have done studies on schools asking about their indoor air quality. And so we knew that there was a need there. So we filled that need with our action kit, and we really thought ourselves to be really clever when we put the kit together, because we weren't going to just do guidance in a binder. We weren't just going to do another book and put it out there, right? And so the action kit was meant to be just that. Put into action. And so instead of putting it into a binder, we put it into a box, and that box had a little piece of Velcro on it that when you opened it, it made a very satisfying sort of noise, and you were ready to go into action, right? And all of the checklists could be brought out and walked around and replicated. And the idea was for this to be a comprehensive action activity that involved the entire school community, right? And so we were really excited. And so we were really shocked. And when we announced this and launched it, that the kits weren't flying off the shelves, right? And we're like, so what's that about? So we did this really dangerous thing for government where we went out and we actually talked to people, and we asked them, so, what's up here? What's going on? Why are you not playing with our kit? We know that you need it because we've seen the studies. Why aren't you doing it? Well, what we discovered, I'll take the next slide. What we discovered was we had overestimated people's capacity. We were on target with the need, right? And with the interest. What we had overestimated was people's ability and their capacity and their readiness to actually put comprehensive indoor air quality programs in place. And so we went back to those folks and we found the folks who were actually taking action. And we said, okay, so what are you doing? And why is this working for you? And then we went to the folks who weren't, and we said, okay, what's stopping you? Why are you not doing this? And what we heard was from the folks who weren't doing it is, we don't know where to start. It's too overwhelming. There's too much to do here. And we realized that just because we were calling something an indoor air quality management program doesn't mean that those words had any meaning out in the public, right? Certainly everyone was taking actions that impacted indoor air quality, but not many people were marrying those actions to the idea that there's a comprehensive plan that needs to take place here, right? So when we talked to the folks who were putting the kit into action, we said, well, what are you doing? How's this working? And we heard what sounded initially like hundreds of different actions, right? But when we started to really listen to more and more schools, patterns started to emerge. And when we saw those patterns start to emerge, we did this other really powerful thing. And I cannot emphasize the importance of this enough. We named it. Naming things gives them power. Voldemort, right? Naming things gives them power. So you want to identify what's going on and name it. And that's what we did. And then we put it into a framework, this system for continuous improvement, because everything that people who were successfully implementing the kit were doing fell into a handful of buckets. So we named them. They were organizing effectively, communicating, assessing, planning, taking action, and evaluating. Every single action fell under one of these continuous improvement drivers. So we named them the 6 key drivers. We looked for the strategies that were actually taking place in school districts, and we started to create our knowledge base around it so that people could accelerate best practices. So I'm going to take you a couple of steps deeper into a couple of them because they relate specifically to some of the questions that you were asking, and because they are kind of married together here and critical, especially when it came to response to COVID-19. So I'll take the next slide. So we're going to take a look at the assess driver and the evaluate driver, right? So one of the things that, people always want to know, what should I do? What should I do? What should I do? Well, we can, and they want it easy. The people want, tell me the top five things that I should do. Well, we could tell you the top 5 things that you could do. The thing is, there are hundreds of things that folks could be doing, and the top 5 are going to be different for every school. So how a school determines what their top 5 things are before they go on to the other things they need to do is through assessment. And what we were discovering is that people did not know and understand their facilities. They didn't understand their HVAC systems. So we have checklists and the action kit to help you assess every element of your indoor air quality. But, the walkthrough checklist, ventilation, food services, a teacher's checklist, everything. So walk the grounds, listen to your occupants, determine your baselines, right? And identify and prevent risks. So before people jump into action, the assessment factor is really important. And those baselines become important. Next slide, please. Because the evaluate driver is one that is deeply connected to all of the other drivers. When people are asking, okay, what should I be monitoring? What should I, what should I be looking out for? How do I know that that I'm achieving what I should achieve? That's the evaluate driver. Problem with the evaluate driver is this is not a linear process, right? This process is iterative, right? And so what happens often is we get to the end of a process and then we want to evaluate. Well, if you're evaluating at the end of a process or at the end of a project or at the end of a program, that's not an evaluation. That is a postmortem. So what you want to be doing is figuring out from the beginning, based on your assessment, what it is you want to measure and assess as an indicator of your success. So if you're trying to, we just had this conversation with some school leaders just last week, where we had a woman who was just so frustrated and flummoxed about what to do because she knew that the bus idling that was going on outside of their their air intake had to be having an impact on what was going on in the classroom. And she says, and we keep monitoring for CO2 and we're not finding high CO2 levels. And it's like, well, because you're monitoring for the wrong thing. You're in this case, you want to be monitoring for carbon monoxide, not carbon dioxide. You're never that. So if you're waiting for CO2 to be an indicator to get people to take action on bus idling, you're looking for the wrong thing. So it's a matter of doing the assessment, identifying what the issues are, then identifying what measures you want to take to address those specific things. It's never going to be as easy as here are the 5 things and here's what you do. It's tailored, and that's why our kit is tailored to those kinds of outcomes. But what that means too then is, I'll take the next slide. Communication becomes really, really super important. So how you're going to develop a communication plan to help people understand what you're getting when you're doing the monitoring, what you're getting when you're doing the actions, why you're doing the actions, and involving everyone in that process. And I mean everyone, from teachers to the torch-bearing villager parents, everyone. You're bringing them in and communicating all the time to everyone, right? I'll take the next slide. So once we had the kit and we told people what to do, and we had the framework and we're telling them how to do it, then folks were still like, there were still people up in the rafters who were like, can't hear you, don't know what to do, what, how, but what do I take action on? And so that's when we came up with the 7 technical solutions. Give me a click, please. So with the 7 technical solutions, these are the areas that you really need to be focused on. And one of the areas that people really want to focus on primarily is HVAC, but all of these other factors, mold and moisture, integrated pest management, source control, really critical, and they all are interdependent and work together. So during COVID, as we asked for more outside ventilation, give me a click, please, the issue came up. Well, what about energy efficiency, right? And even before COVID, there was this belief that there was this Faustian choice between good indoor air quality and energy efficiency savings, but it's not. They are 2 sides of the same coin. Next slide. Because as we know, if you are taking the steps to put quality HVAC systems in place, to maintain your HVAC systems, to assess them and understand them, then hoorah, was good. You're going to be able to address all of the key critical factors that have been so important over this last 3 years, but they were really critically important over the last forever. Outdoor ventilation, filtration, relative humidity. So you're putting these strategies in place, right, to be able to maintain that. But also, I'll take the next slide, they are going to have a positive impact on your energy management as well. And really the issue here is understanding why you're putting the strategies in place for both of these technical solutions and how they work together. Because yes, sometimes your energy efficiency is going to take a hit. Okay. But if you have planned that hit, if you have decided that this is what is important for your overall outcomes, then everything is going to be okay, right? And you're going to be able to communicate that because you are making informed decisions. I'll take the next slide. So one of the other areas that came up, gosh, things went so quickly during COVID. Give me a click, please. And we were learning in real time, what to do and how to respond. And initially, the effective cleaning and maintenance was where we were really drilled down, because we thought everything was, was transmitted on surfaces. It was fomite transmission. Well, what we discovered was, as we discovered more, we learned more about the importance of indoor air quality and effective cleaning and management in that arena. So even before that, I'll take the next slide. When we were doing the strategies for effective cleaning and maintenance, one of the things that we said is you need a preventive maintenance plan, right? And so we told people that, but we didn't tell them what a preventive maintenance plan looks like. So it's one thing, what we often find is that when it comes to indoor air quality, everyone is at best often responsive. There's a problem, you identify it, you go and you fix it. With preventive maintenance, of course, what we're expecting is that you have a plan in place that allows you to be proactive. You get ahead of the problem, right? And in the best cases, predictive. You kind of know what's coming so that you can make a plan to avert it ever happening. The best indoor air quality solution is never to have the problem, right? So, but we didn't have, so we told people, make a preventive maintenance plan. I'll take the next slide, but we didn't have one for them. Well, now we do. So now we also have our preventive maintenance guidance, which takes schools the next step into helping them be more predictive in their indoor air quality. And we do that by, next slide, breaking it down into steps that are even deeper, still predicated around the framework, but really how you go even deeper in developing your preventive maintenance predictive plan, how you create the buy-in to make it happen, the communications and the staffing tools, how you train your staff in a way that makes them able to be more proactive and predictive. And then how you're able to evaluate on continuous improvement. So lots of great materials there to be able to do that. So, so we were doing all of that. That was all kind of great. Next slide, please. Then along came COVID, which of course was a game changer for everyone. And it's hard to believe now that there was a time when we didn't recognize the direct connection between COVID that COVID was an airborne transmitted disease, a virus, but it was. And so once that arc of knowledge became apparent to us, then we started to really, well, along with our colleagues at the Centers for Disease Control, started to really hammer that message home about the importance of HVAC, indoor air quality, and reducing airborne transmission. Next slide. So one of the things that we did, that we realized, was there was all this emerging and new technology that was showing up. And all of a sudden we had industries, we had people who were trying to sell people stuff and who were trying to, to squeeze in on this space of vulnerability that schools were experiencing as they were in an emergency situation and trying to stay open. And we had a lot of people kind of capitalizing on that fear and on that urgency. And so what we wanted to do was keep people rooted in the basics, right? So the proven strategies to improve indoor air quality in schools, and really the three main things that we were promoting the schools do first when it came to response to COVID, but really this is for every infectious disease and for just quality indoor air overall. Increase your ventilation rates, increase your filter efficiency, and then after doing those things, when necessary, supplemental air cleaners to make sure that you're getting an appropriate air exchange in your classrooms. Next slide, please. And we delivered that message across the federal family and with our friends at Centers for Disease Control, at Department of Education, at Department of Energy. Everyone was sort of singing from the same song page when it came to making sure that you are addressing these three proven strategies first, right? Next slide. But then also the other message that we had an opportunity to put forward along with our researchers and folks that we're working with at universities and whatnot was the importance of action through layered risk reduction. And this was a great time for us to talk about both engineering controls, but also administrative controls. So, when I first started in this work 30 years ago, one of the trainers who was teaching me about indoor air quality, he would always say, people think indoor air quality is difficult. Indoor air quality, it can be complex, but it's not difficult. People are difficult, right? And if you're not dealing with the administrative controls, you're never going to get the kind of outcomes that you want. And so we were really delivering this message as well, that in order for your engineering systems to have a fighting chance, you also have to be doing the administrative controls, the masking, the distancing, all of the things that we know that are important to do in coordination, layering those interventions. I'll take the next slide. We put out at the U.S. Environmental Protection Agency, we put out a ton of resources that were responding directly to COVID-19. But again, all of those resources also were messages that we had been trying to get out to the public forever on indoor air quality. This just gave us an opening. It gave us a moment in time to be able to do it. Next slide. And so with so many of the resources we'd already set up, like our professional webinar series, we added a whole suite of webinars that were directed to primarily towards virus mitigation. Next slide. So yeah, I'm going to bring it home here. And it was really important, for us to, one of the most important things, and you've heard it through here as we've talked about the triple bottom line, is the value of indoor air quality preventive maintenance and the value of putting in place these comprehensive plans that braid together indoor air quality, preventive maintenance, and energy efficiency. And so one of the other administrative controls, I'll take the next slide, that we do is helping school districts understand their value proposition. So often schools and all of us get focused on costs. We get focused on savings and on the bottom line for the dollar, right? But the fact is we bring all manner of value to a school or a school district when we're doing indoor air quality. Next slide. And we have to be aware of that value. So when we go back to the idea of asthma, right? One of our school districts, the Northeast Independent School District, they're down in San Antonio, Texas, created this, their bold goal and their vision for indoor air quality. Their bold goal was, our program focuses on creating healthy learning environments for all students, including reducing asthma triggers through comprehensive indoor air quality and asthma management. So their school nurse and their facility manager got together, implemented the kit, and then they tracked the results that they were having with their students with asthma, and they monetized it. So yes, it is looking at the savings, the cost savings, but it is also looking at the things that the human costs, and it is looking at how they interceded for learning, right? And those learning bottom lines. And so they spoke to that triple bottom line with their bold goal. And we have actually resources to help schools develop their value proposition, looking at more than just what it's costing and what it's saving monetarily. Okay, take notes for as much as this serves you, but all of this is available on our website through our webinars and through other materials. Okay, I'll take the next slide. Our friends in Salt Lake City looked at, healthy cleaning. And what I just very quickly, what I just love about this value proposition is, again, they are all about doing the best thing, using, being good stewards, being good fiduciary stewards of the district's money. But their value proposition was all about the people. They were about creating a culture of leaders at all levels. They wanted their custodial staff to feel empowered, to feel educated, to be leaders, to be knowledgeable. It was all about the people for them, right? So that their personnel is trusted and respected as the professionals that they are. So there's lots of value that we bring here. I'll take the next slide. So, the story of America's schools is one of leadership and change and evolution. And our schools are the place whenever we've had a really thorny social public health issue, where do we go? We go to the schools. Everything from desegregation to immunization to food insecurity. It happens in our schools. And so when COVID came around, that was when it really became clear that our schools are more than just a place that people go for academic instruction. I'll take the next slide. So it really became our defining moment. Give me a click. So COVID, like I said, is the thing that we never would have asked for, but man, did we show up in that space. And so, yes, that was our moment. And through everything that we have seen our school districts doing to respond to it, everything we have seen our nonprofit family doing to respond to it, we have taken this moment and we have turned it into a movement. But now it is time for us to take that movement and, through the work that we do in our schools across the world, make this movement a monument to improved health, to better facilities, to the places where our students deserve to be. We can take this moment that's becoming a movement and make it a monument to public health. I'll take the next slide. So I really want us to be thinking about what's important to you. What are your core values in this moment? The picture there is my grandmother. She was born in 1915. She would have been about 20 years old in this picture. And she would always say, she would always say, when you know better, you do better, right? My grandmother, born in 1915, was a high school graduate. There were not many high school graduates of any sort who were born in 1915 in the United States, let alone an African-American woman. She was a high school graduate. My mother was a college graduate. I have a master's degree. When you know better, you do better. I am devoted. My core value is helping people know better when it comes to indoor equality so they can do better. We are rooted in our core values, the things that we care about. And so I invite you to think about those core values for yourself and to live into them as you do this work. And I thank you. I'll take the last slide. I thank you for your time and for your attention. And I invite your questions.
So it was a question about politics, about how children not wanting to get involved. Pete? Schools not wanting to get involved.
Yes, schools are, well, yeah, schools are notoriously skittish about anything that looks the least bit political. And so I think that, which is why it is so important to stay rooted in that triple bottom line of health, occupant health and academic performance. And so, as you know, we before COVID, there was nothing particularly political about, making healthier indoor environments for kids, right? And so if we can stay rooted in the primary outcomes and goals that we're focused on, that this isn't about, this isn't about the amount of traffic, this isn't about taking away your vehicles, this isn't about any of those things. This is about the direct impact that it has on our ability to have safe, healthy, clean environments for these kids so that they can be healthy, show up to school, and perform at their best. And so that messaging, you need messaging that nobody can screw with, right? You need messaging that is mom and apple, well, it's American mom and apple pie, but that is rooted in things that are non-political, that are just the right thing to do.
Thank you. Other questions? Henry. Shall I come on? Yes, come on. Hey Tracy, I thought it was absolutely inspirational and really nice to hear a very different perspective of experiences from your side of the Atlantic. You mentioned that you initially became aware that schools weren't engaging with your plans, and then I'm sure you did more than just name them, but you took a series of actions. And then how do you evaluate how many schools engage with your plans and the impacts of those in any way, or is that not possible?
So, great question. So a couple of different ways over the life of the program. So and I'll go from so every webinar that we do, we do an evaluation at the end of every webinar, and so actually we do a pre and post for all of our action learning activities, right? And we invite people in. We ask about questions about whether or not they have plans in place, if they do, kind of what they're doing, and then at the end we ask about the change in knowledge from what we have presented, but also a change in their ability and their capacity to take action. Okay, so, but that doesn't tell us if they actually have taken action, right? So what we did for a number of years is our friends at the Centers for Disease Control had, they had a survey mechanism that they use for school districts to understand the impact of environmental health programs there. And so we were able to get some questions in on their national survey of schools about indoor air quality. They have stopped funding that survey in the last few years. And so we are in a little bit of a quandary right now about, how we are able to specifically identify actions that are taking place based primarily on our program. However, we just got a little windfall from the federal government. So the Inflation Reduction Act provided $50 million to our program in order to stand up a grants program and to deliver technical assistance. And so we are excited about the opportunity to stand up our own measures process so that we can start to survey schools again to see what actions they're taking as a direct result of our work. Fabulous question. Thank you.
Thank you. Yeah, thank you. Can I ask a follow-up question, which is, what is the scale of your kind of operation? How many people involved in this? I know America is a much bigger country than us, but it does seem like a huge effort that you have here.
It is a huge effort. You would think that we had a cast of thousands. However, we do not. And so because again, remember, we are a little non-regulatory corner in a huge regulation writing monolith of the EPA. And so at our zenith, at our absolute apex, we were functioning with the most we ever had for this program was about $1.5 million, and about 8 staff members. In 2011, our budget was decimated. And so we have been functioning with about 5 staff members on a budget of about $300,000. And we make this magic happen, right? But I think that the reason is because we invested that middle pillar that you saw, that stakeholder pillar, it is so critical. So when we were flush, we invested in grants to environmental education and public health agencies that were directly related to indoor air quality in schools. We gave them little grants, and a little grant goes a long way. We did recognition programs for school districts, and we gave them awards and recognized their behavior. So we created this cabal of indoor air quality zealots who, even after we didn't have the money to fund them, we continue to convene them. They continue to staff out our action learning. They serve as our brain trust on the development of all of our resources. We can call on any school district who we ever give an award to, and they will mentor other school districts. And so when we had the money, we invested it in the people. And that has continued to broaden our reach exponentially.
Thank you. We have a question from online from Mike Holland. Mike, you're on mute. Do you want to unmute yourself and ask your question?
Yeah, thanks very much for that. Yeah, sorry I'm not with you today, everyone. That was a really inspirational little lecture you gave us there. So many thanks. Many thanks for that indeed. And there's plenty in there to think about. We've spent a lot of time thinking about issues like ventilation and so on. One area that we've not really looked at in much detail at all, featured on your slides, I don't think you could have mentioned it so much, but it was the smart materials selection. So avoiding bringing stuff into classrooms that is going to cause problems. In your slide, you mentioned product rating systems and so on. If you've got some more guidance for us on that, I think that would be really useful. Thank you.
Yeah, well, thank you, Mike. We absolutely do, and I would invite you, especially to take a look at what we have online for our preventive maintenance section, as well as the kit too. But smart material selection, yes. So we have third-party raters here in the United States, and that's what we to sort of direct people towards. And so folks like Green Seal is one of them. Within EPA we have our Safer Choice group, right? And so you're looking for UL Universal Labs here. And so just making sure that you are doing the due diligence that the products that you're choosing are matching up with the goals that you've identified for your schools. And so if you're really looking at lowering, volatile organic compounds, you're doing that you are actually, that when you're choosing those materials, but also when you're bringing them into even the best made materials, are still going to off gas, right? And so we have guidance for how you conduct, how you make sure that that off gassing is happening in a safe way, when how to install, how long to, to wait, those kinds of things. So lots of good resources in our materials there. But thanks for bringing that. Yeah, so smart material selection and source control, man, just don't let it in, right? So.
One more question from Doug, and then we'll wrap up.
I know, I feel very on the stage here. Hi there, Tracy.
Hey there.
Thanks for the amazing presentation. You mentioned that schools are where you see the change starting, and you gave some really interesting examples around vaccines and desegregate, sort of, mixing the population. I was wondering whether you brought up the example of the school-based healthcare and whether you'd use that at all. I was thinking as well as sort of going beyond the school classroom and also thinking about taking it home, because in the UK, the health service is starting to look at social prescribing for indoor air quality, whether that's providing air monitors to particularly vulnerable groups at home, but also air cleaners, and whether you're sort of using the school to start that momentum.
You guys are so much better than us. So but anyway, I think I need an internship over there. So yeah.
Well,
so
it actually seems like the other way around a bit with us. I mean, I'm in awe of what the US EPA seems to be doing on school indoor air quality.
Well, thank you. I appreciate that. And honestly, and so if you have a direct link, like it sounds like you do, to, through your public health service, between school and home, I think that is phenomenal, because so that's one of the places with one of the other programs that we have is we have a community-based asthma program within our division as well. And so that's where we see a lot of the connection between school and home, because when you have students who have asthma, they don't just have asthma at home, and they don't just have asthma at school, right? And so which is why we're able to give that great example from San Antonio, Texas, about the connection between asthma and indoor air quality. So yeah, so we have a few materials that address, sort of the home setting from schools in the kit, but where we really kind of like drive it home is through our asthma program. So yes, if you have programs that are public health based, partnering that with your indoor air quality, because again, I think one of the biggest mistakes that we made was thinking people knew more than they did, because we live and breathe this stuff, literally. This is our wheelhouse, right? We sometimes assume that other people, of course, they know that this is an asthma trigger. Of course, they know this indoor, air quality issue is an asthma. Well, they don't. They really don't. And that's one of the first lessons we got in our asthma program, was that people did not recognize the indoor air quality triggers, that they were actually triggers that needed to be mitigated. So yes, I would say look for where you have those inflection points for health, and then bring in the school aspect, as opposed to trying to do it the other way around.
Yeah, thanks, Tracy.
Thank you very much.
Certainly.
Thank you. So I think we'll wrap up there, and thank you, Tracy, for a fantastic presentation. Several people have said inspirational, and I think we all feel very highly motivated and inspired by what you've just said. And thank you for your time today. It's been much appreciated. And we hope you'll stay in touch with us, and we with you, as we both work in the same area with the same goals, I feel.
Absolutely.
So thanks very much.
I feel like this is the beginning of a beautiful friendship. I'm looking forward to us continuing to work together. Thank you.